Hello everyone, and welcome to yet another episode of Tiny Matters with Dr. K. I'm your host, Dr. Kutso Sebetseva. Now, few words stir up as much fear, confusion, and emotion as the word autism. For some families, it brings relief. For others, panic. For many, a flood of questions they don't know how to place. Today's conversation is about replacing fear with clarity and panic with understanding. I'm joined by neurodevelopmental paediatrician Dr. Bongi Mbatha, who helps families to navigate the diagnosis of autism and many other neurodevelopmental disorders. Thank you so much for joining us, Bongi.
It's a pleasure. Thank you for having me.
Okay. Tell me a little bit about your work. What is it that you do?
So I'm a developmental pediatrician. So what that means is I see children with developmental conditions, neurodevelopmental conditions. These are children with autism, ADHD, genetic problems, learning disabilities, motor problems. So that's what I do. And I help families manage the complexities of those conditions, because it's not like diabetes where I can prescribe something.
Yeah.
So we have to manage the whole family, not just the child.
Sure, I can't even imagine the complexities that come, particularly with something like autism. Mm-hmm. But let's start with something more simple. Mm-hmm. From a brain point of view, what is autism?
So it is a neurodevelopmental condition. So it starts during the time of development, and it affects two main areas. The one is socialization and the other is communication. So these children have difficulties in socializing and in communicating.
Firstly, I think I like how you called it a condition,
yes,
and not a problem,
yes,
because it helps us to kind of reframe what we think about, neurodiversity and neurodiverse conditions. But you mentioned socialization, so problems with socialization. Mm-hmm. What does that actually mean for a parent who's trying to raise a child?
Okay, so socialization problems is how you interact with society. So these children, some of these things we take for granted. Mm-hmm. So that when your name is called, you turn and look towards the person that's calling your name.
Yeah.
It's how society, it's a response that you have, whereas these children struggle with that. So they will struggle with responding to their names. Making eye contact when you're talking to someone is something no one tells you to do, but you learn through socialization. So these children will struggle with eye contact and reading body language. You know, when you are upset with your children and you give them that look, they understand, mommy's upset now. If you have socialization problems, you might not understand things like body language, and you yourself may not use your body to communicate effectively. So they don't point, or they may not point when they're showing things, or their facial expressions don't go with the emotion that they are expressing. So those are the socialization problems that they can have.
Yeah, and then just thinking about it, I can just imagine the problems that arise from such a thing, right?
Yes.
It's probably why they carry certain labels like rude or naughty or
disrespectful.
Yeah. So what we do know about autism and what's kind of common knowledge is it's called an autism spectrum disorder, right?
Yes.
Which means that it's a spectrum, right? What does that mean? And what does that mean for the ordinary parent who's just received a diagnosis of autism on their child?
All right. So we call it a spectrum because it presents differently in all the people who have autism. It's very rare that you will find someone who has autism that presents exactly the same as someone else. Even in twins, it will never be exactly the same. So in terms of the spectrum, it's the communication disorders. Some children speak, some children don't speak. Some children speak in single words, some combine just 2-word sentences. So that's the spectrum. We don't know whether your child will speak in sentences or in single words. And then even the problems that they may have, it's a spectrum. It could be mild, moderate, severe, or profound. And they can fall anywhere along that spectrum. And there are other co-occurring things that happen with autism that also present as a spectrum. So essentially we're saying that when you diagnose one child with autism, or you've seen one child with autism, the next child that you see can have autism, but it'll look completely different to the child's autism. But the core features are communication and socialization, and then they also have repetitive behaviors. Yeah.
Sure, that's very interesting, right? That each and every single individual with autism will look completely different, right? Yes. So you could have two children with autism and they don't look the same.
And they don't have the same. Yeah.
And I imagine that's so difficult for parents, and it adds to, number one, the difficulty with understanding the diagnosis.
Yes.
Number two, the treatment, so getting to a diagnosis and managing the condition, because it obviously then starts to look completely, well, maybe not completely different, but look quite different from person to person, because it has to be so individualized.
Yes, very much so, that it has to be individualized.
I recently did another episode with a clinical psychologist where we spoke around, parental guilt, particularly in this case at the time of diagnosis of something, quite difficult to navigate and quite atypical, if you know what I mean. Yeah. I'm sure a lot of parents come to you and ask you, did I cause this? Was it something I ate in my pregnancy? Yeah. Is it something I said to the neighbor? Yeah. Is it my partner? Yeah. What do you say to parents who think they may have played a role in their child being diagnosed with autism?
So one, it's something I address with each and every parent, is that it is not your fault. There is nothing that you could have done to kind of prevent the autism. Yeah. It is a genetic condition. There are genetic conditions that can result in autism. So we can investigate for those genetic conditions. It can run in the family. So you can have an uncle who had autism, or a brother or a cousin who has autism. If you trace, you may find they had some of those features. There's nothing in terms of what we eat that can cause autism, or things that you do in pregnancy that will cause autism. Yes, there are certain risk factors. So if your children are premature, they have a higher chance of having autism. If you have someone in the family with autism, that will increase your chances. But those are things that you have no control over, in terms of it's not your fault. And this is something that you will not see at birth, because it's a developmental condition. So we'll only pick it up as the child is developing. Yeah. So it's about reassuring the parents and telling them that it's not their fault. There's nothing they've done to cause the child to become autistic.
Yeah. I mean, I think that's so important. Yeah. You're obviously aware of, claims.
Yes.
Around causes of autism.
Yes.
Be it anything ranging from vitamin K to ingredients in
vaccines, ingredients, toxins, lead. There's a whole
Can you just debunk that for us, please?
Sure. So essentially, there are risk factors, and those risk factors are sitting mostly in the genetics. So you'll have a genetic predisposition, and then if you're exposed to something, then that gene may then manifest as autism. Let's talk about the big one, being the vaccines. The big vaccines, the 18-month vaccine, where the children, if they go get MMR or measles, or they're going to become autistic, or it causes autism. It's not that. It's because autism, we will usually see the signs around that age of 18 months. And when you think about it, you're like, but my child got a vaccine. And so that is where it came from. But it has been disproved. The link is not there. So it's not the vaccines that are causing the autism. And every other thing. I mean, I know parents who are giving vitamins, who are stopping their kids from taking certain foods but none of it really is. So for me, it's first do no harm.
Yeah,
Please don't take your child for injections every week because you're trying to prevent the
or
autism,
not take them for
or
their
not
vaccines.
take them for their vaccines. Yeah.
I think I can almost understand how all this stuff came about, though. You know, when something is poorly understood, people are going to try and fill in the gaps. You know, and imagine for a desperate parent who's just been given this diagnosis and is desperately searching for answers because I did everything right. Did everything right in my pregnancy. You know, I went to the clinic, I took my vitamins, and still at the end of that, you tell me that my child has autism. And you tell me you can't actually determine why. This may be the first child in the family, you know, I'm maybe hearing from the neighbors that it was caused by whatever. So I almost understand why there was a need to fill in those gaps with, you know, because when there are gaps, we'll fill them in.
Definitely. And the one thing I always tell my patients as well is sometimes we can look as much as we want. We won't find the cause. And in actual fact, it's not about finding the cause. It's about helping this child, your child, reach their full potential. So what can we do to help the child? Let's not look at what the cause is. Obviously, if it's a cause that we can do something about, then But, and I'm talking about causes where it might be genetic and we know in the next pregnancy or the risk for that. But otherwise, it's more about helping your child reach their full potential and not focusing too much about the cause. Science is still trying to find the cause.
I think I think that's what makes it, you know, so difficult for people to navigate. I've seen a lot of social media posts, and you know, a mother will post a video and say, "This is when I knew that my child had autism," you know, and sometimes it's super early. I mean, I saw one where the baby was probably couldn't have been older than 2 months old. And the mother said, you know, it was at this point that I knew, right? And I mean, I think I preach time and time again that, you know, parents must trust their gut, trust your gut, right? But truthfully, realistically, factually, what are the earliest signs of autism?
So the earliest signs of autism would be the child not responding to their name. So what usually happens is by the time a child is 6 months old, in terms of development, typical development, if you call them Spongile, you know, they recognize their name. If you say Mama, they know who Mama is, Papa. The words they've heard a lot of, they then respond. These children may take longer to respond to their name or not respond to their names at all. They may have speech delay. So their speech may not start at the usual age, around 9 to 12 months with their first word. They may not point. So pointing is a very important developmental step. And there's pointing where you're showing, and then there's pointing when someone else is pointing and you look to see at what they're pointing at. And if those are not developing well in a child, then there can be signs, early risk signs that there may be something to do with autism. It's not the only thing, but we look at those signs and you put them together in terms of early signs. And they can also have this fixated interests where the child has these toys and they're only interested in a certain part of the toy, or they'll line up their toys and want them in a specific way, or certain colors must be, all the colors must be together. So, you know, when children just play, they normally play with all sorts of everything. But this one just wants to play with this one. So those are the signs. And I think parents who know their children, that responding to your name is so important to a mom. And the other thing that we have to talk about is if you suspect that, we have to rule out a hearing problem.
Absolutely. Okay. All right. I mean, I think these are great signs. I think for a parent who's like, should I be worried about that? That's easy to look for, right? So what about these claims? What about these earlier signs that we sometimes hear about? You know, like the no eye contact, the no smiling very early on at 6 weeks.
So Those are difficult, and the one thing is a mom always knows her child. So if a mom comes in with that, you will reassure her and you'll monitor that child's development. There's not much that can be done in that period if you're noticing it. Then you'll tell the mom, bring the eye contact, make sure it's close, smile, talk to the baby. But in terms of science, they have looked at eye movements in terms of whether children focus on the face. So when you are young at around 6 weeks, you focus mostly on the face in terms of vision instead of focusing on something that's not a face, whereas they find that kids who have autism may not focus on the face or the whole face or the eyes. They may focus on a part of the face or the mouth, or instead of focusing on all the whole face. And so there are studies that they have done. But I think from a clinical point of view, if mom is suspecting it, it's usually the mothers who've got another child with autism, so they're highly alert. Or it's a mom who's got someone else in the family, so they're looking for these signs. But a first-time mom might not pick up those early signs. But I think around 9 to 12 months, no eye contact, not responding to the name, not pointing, very particular about the toy. Then
a little bit. A red flag of sorts.
Yeah, definitely.
All right. Okay. All right. It's difficult with kids because kids are not the same,
They're
right?
not the same, yes.
So, I mean, if we're going to go on temperament, or we're going to go on how much they talk, how much they communicate, or how they react in your environment or with strangers, especially now where autism has become a little bit of like a buzz, there's definitely kind of a hyper alertness and an increased awareness around autism. How do you then differentiate between a child who's got their own kind of individual, different, maybe slightly delayed temperament, speech, socialization skills versus a child where we really should be worried about autism?
So we look at typical development in terms of the child, and with development, there's always a range in terms of when a certain milestone should be achieved. So the first word, some kids can say it at 9 months, whereas some kids will only say it at 14 months. And that may still be normal-ish. Okay. So the thing is that autism is a neurodevelopmental condition. There'll be more than one thing. And personality or temperament is very different. Children with autism also have their own personalities. So you have an autistic child who's bubbly, and you have an autistic child who's serious. You have an autistic child who's an introvert. You have an autistic child who's an extrovert. So personality and temperament versus the actual diagnosis of autism are two different things, and children with autism can have personalities and different temperaments. But the diagnosis of autism, it is a strict diagnosis that we have to tick all the boxes.
And like you say, it's across many different domains.
Domains.
Okay. I think that distinction is so helpful. Again, in this like age of online access to everything, because quickly we want to assign a label to a child. Social media and the internet.
Can talk all day.
Probably friend and foe, particularly when it comes to autism. What do you think it's done for the diagnosis of autism, information around autism?
So, I mean, we love social media and the internet in that there's always a plus and a minus, a positive and a negative. So all the positive things is the increased awareness. People now can watch other people talk about their autism journey, and so that increases awareness. But the negative parts is, as I said in the beginning, it is a spectrum. So what you see on the social media might not necessarily be your child is presenting with. So if you're really feeling that your child's development is not following typical development, go and get your child assessed by a professional, and don't rely on just the social media. But we love it for awareness, because here we are trying to spread awareness as well. So there are good parts, but if you have any suspicions, then go and get professional help. And
it's difficult now, because there's checklists, there's diagnostic tools, like self-diagnosis questionnaires that you can do. So it's I don't know if I think it's a friend or a foe at the moment. I do agree with you with the increased awareness. I am finding more mums come as self-referrals saying, "Doctor, I'm worried about this."
I've done because my research.
So it can only help.
Yes, we hope.
Within limits. South Africa is always going to be different with a lot of things because of how rich and culturally diverse we are, right? Again, friend and foe. I think the community living and the help we still have, in terms of raising our children, is helpful. But I imagine that, especially when you get a difficult diagnosis on your child, there are a lot of cultural, traditional, all sorts of inputs that we're gonna get, all sorts of opinions that are gonna come. What are the unique challenges you think South Africans face in terms of the diagnosis of autism?
Okay, so that's a very loaded question, but I'm going to try and answer it as best as I can. We are definitely culturally diverse. We've got 12 official languages, so it does make it difficult. I think the biggest challenge we face, one is there is no African word or vernacular word for autism. And I've tried to look for other countries and other languages and to see if they have a word that describes autism. I think for most of our African heritage, when we describe a condition or when we name a condition, we actually name it according to what it is. Like in Zulu, diabetes, isifo soshukela. Exactly. So you understand what that is. Whereas we haven't found a word for autism, but I found the Maori word. It's taki watanga, and it means in his or her own time and space. I think that's actually beautiful. Captures autism. And so when we make the diagnosis of autism, it's always the first thing, the grandmother, usually it's a grandmother who's come and brought a child, our cultural differences, and they're like, what is autism? What is autism? And then you have to actually explain the conditions. It affects socialization, and then explain in a language that they understand what socialization is, what communication is, what the restricted repetitive behaviors are. But essentially, because there's no word, I have to sit and counsel on the whole thing. And then the other thing is we tend to not want to believe the diagnosis. And so family members will come in and say, no, but your uncle was also a late talker. So no, don't worry. In our family, we're all late talkers. The child will talk. Just forget those doctors. Or, you know what? We need to have a cultural celebration or traditional ceremony because certain things, you're not married to the father. So now we must do this for the child because, whereas... they can do all of that. Just get the child help. So I think those are the difficulties we face as South Africa. And I haven't mentioned all of them, but these are some of them that we've come across in terms of the diagnosis.
Because I imagine they are everywhere. They are in the diagnosis, they are in the help-seeking behavior.
All of it. All of it. Even in the management.
I actually think that word that I'm not going to even try and pronounce describes it so apt. And it's made me think of the number of times parents have come in and said to me, it's like he or she is in their own world. Like I actually got goosebumps when you said it, because that is exactly what it is. And the moment they say that, it's like you just know.
They know, they've figured it out. And those children are like in their own world, and we need to take them out of that world and bring them to interact with our world. And also we need to come into their world.
As
exactly.
well. Yeah. And that comes with understanding.
Yes, that comes with understanding.
What does that look like? Bringing them into their world.
Coming into their world. It's different for each child, but I'll give you an example, and it's an example that came up recently. I was at a clinic, and the mother, I'm asking, so how academically, this is about a 7-year-old, academically, does he know numbers? And the mom says, yes, he can count, but he loves dinosaurs. And we had these toy dinosaurs on the table, and he started naming them Brontosaurus, and he's going on with the names. And I said to Mom, let's see, can he count to 10? He wouldn't. He didn't. And it's because he was so focused on the dinosaurs. And then I said to the mom, no, it's fine. We're going to use the dinosaurs. We started using the dinosaurs, and I heard him counting. And then I said, oh, okay, if I give you 2 dinosaurs, 2 brontosauruses and 2 stegosauruses, how many will you have, And you can get that concept out. So you've got to go into their world instead of just maths must be taught with your abacus or counting blocks or whatever. If they like dinosaurs, let's use the dinosaurs. You can still add those concepts to those things. And people say, no, he's only focused on the dinosaurs. It's fine. Let's use that.
Yeah.
Or he only loves music. Then let's teach him songs where we are counting or where we're learning the alphabet.
Yeah.
So we must teach them in the way that they learn.
Yeah.
That's how we can come into their world.
Yeah.
Is we want to teach in one way. And there are many ways to teach, and they're teaching us that the brain works differently.
Yeah.
And it's a different operating system. But if you know how it works, you can teach them.
Yeah.
Yeah.
That's so cool. So as a parent, where do I start? I'm worried my child is not pointing. He's not speaking to me, not saying the 1 or 2 words. Where do I start? How does this journey actually begin?
Okay. So it's a long journey if you're in the public sector. But if you're in the private sector, you can go to your paediatrician, your GP, and just lay your concerns, and then they will assess your child. In the public system, not that you can't do that, but you don't go to a GP or go to a paediatrician. So you would start off by going to the clinic. So on your normal clinic visit, or even just a normal visit, you can go and say, sister, I'm worried about my child. They're not pointing, they're not saying their first word, they don't look at me. In the Road to Health booklet, there's a developmental screener that if the child is not meeting these milestones, they have to be referred. So they will then be referred. I know it's very difficult because some of our primary healthcare workers will dismiss the mothers or tell them, no, it's fine, wait until, but insist. Be an advocate for your child so that they can get referred. The first place they'll get referred to is to see a speech therapist and an audiologist to get a hearing test.
Yeah.
And we do hearing tests in public. So they'll get referred for that to make sure that the hearing is normal.
Yeah.
And then they'll be referred for therapy. And the most important therapy is speech therapy to help them develop communication, and occupational therapy. So occupational therapy works differently in that it helps the child with activities of daily living, fine motor control.
Yeah.
So they can be referred for that. And then when the speech therapist and the occupational therapist can see that this development they will then refer to the pediatrician, or if in the area that you're at there is a developmental pediatrician, they'll refer you to the developmental clinic. But that is the journey that you would go through in terms of trying to get your child diagnosed. The problem, though, is that we don't have a lot of pediatricians in the public sector who specialize in development. And so there may be a long waiting list. And in the meantime, while you're waiting for your diagnostic appointment, you should be attending therapy. So the therapy should not stop because you don't have a diagnosis. The child must still go to speech, must still go to occupational therapy, still have their hearing test, so that by the time they are then diagnosed, we've at least started the journey.
Yeah.
We haven't lost time.
I think that's so important.
Yes.
Because you hear a lot of parents saying, I'm waiting for an appointment with, but the problem is there. And ultimately, I think it would give you a sense of at least calm, at least a sense of I'm doing something while I'm waiting.
Yes.
Because really the diagnosis is someone saying, yes, your child has autism.
It's confirming.
Yeah.
It's confirming. But early intervention is important and has been shown to have the most benefit.
Yeah.
So if you have 2 children, one child does early intervention, another child doesn't, the child who's done the early intervention of speech and OT will probably outperform the one who doesn't, if they have, identical, I'm talking a hypothetical situation. Yes, a hypothetical situation. But so early intervention is very, very important.
What's early? How early is early?
As early as when you have concerns.
Okay.
So what we found, or studies have found, is that from the time the mom has suspicion to the time she gets diagnosis, it can be up to 3 years.
Sure.
So that's why I'm saying if you're suspecting it, go so that you get the early intervention and reduce that time to diagnosis. So mom can pick it up in the first year of life, but only come and see me. And when I see that child's about 4 or 5. So the average diagnosis, and we've published an article in the BMJ from Barra Statistics, we are diagnosing kids at 5.5, 4.5 to 5.5, but they were referred about a year or 2 before that diagnosis. And we want to reduce that so that we can have early intervention.
Because can you imagine the amount of stress, anxiety, misdiagnosis, mislabeling, stigmatization that this child and their family have gone through in
even
that 3
medical
years.
expenses.
Yeah.
Parents spend a lot of money trying different things, trying to fix the problem.
Yeah.
Yeah.